we've got some real developed ideas at the Health Cost Initiative based on focus groups we've done, based on leaders we've talked to. But if we can't build a bigger tent for advancing those ideas, they're not the right ideas. So we're taking them out into different sectors and doing surveying and kind of questioning how people are experiencing the health cost crisis and how they might be thinking about the kinds of solutions that we think could get some traction. And that is a way that, we hope the marathon approach, maybe not in one session or not in, one electoral term, will allow us to develop more of a shared vision. In arm with our New Hampshire Possible partners, it's about much more than just healthcare. It's about the broader economic and health and well-being that our residents and families need to make for healthy communities in New Hampshire that we all can contribute to and that we can all feel safe and healthy in.
You're listening to Granite Goodness, the show about optimism, progress, and problem solving across New England, proudly hosted in the Granite State. My name is Andy DeMeo. This episode was produced in partnership with New Hampshire Possible. My guest today is Jennifer Frizzell. She's the director of the New Hampshire Health Cost Initiative. In this conversation, we dive into the many and overlapping reasons for why healthcare costs so much and all the ways that the New Hampshire Health Cost Initiative is striving to make the system work better for Granite Staters. If you've ever felt frustrated or overcharged by the healthcare system, this episode is for you. Let's get started. Jennifer Frizzell, welcome to Granite Goodness.
Good morning, Andy. I'm happy to be here.
I'm happy that you're here. I've been wanting to talk to you for way too long, and I'm very grateful to the wonderful people at New Hampshire Possible for bringing us together today. And we're going to talk about a thing that is probably on everyone's mind all the time in a million different ways, good and bad, but maybe mostly bad. Healthcare, the cost of healthcare, particularly in and around New Hampshire. You know something about this?
Well, I have spent some time lately and quite a bit of time in my career, actually, working on access to healthcare and access to other types of important services for our communities and for folks. And I look forward to putting that work in the context of the optimism and the approach that you're taking to tackling some important conversations here in New Hampshire and bringing community voices together for that purpose.
Yeah, and I'm glad you said that optimism is maybe not a word that people are used to hearing with a lot of topics, but particularly healthcare, I think. So it's funny. A lot of people, I think they have this view that you only focus on the good stuff, the easy stuff. And I was thinking on the car this morning, I was like, man, we're going to get to talk about healthcare, which is one of these really ugly topics that everyone's always mad about. Before we get really technical, and this can get very technical, tell me about your relationship with New Hampshire.
Yeah, well, thank you, Andy. I am mostly a native. And I say that because I understand, having not been born in New Hampshire,
Me too,
what that significance is. However, I did come during my childhood and was educated in New Hampshire. I'm originally from Bedford. And later attended the University of New Hampshire. And at a subsequent stage, after spending a little bit of time in Washington, D.C., I came back to attend law school at the now known as UNH Franklin Pierce School of Law. Yeah. So my connection to New Hampshire comes through my family. It comes through my education. And it really has allowed me to see the way that a small state like ours has an interconnectedness throughout our stages of civic life, of educational life, and of professional life. And that's, I think, a piece of why I'm happy to be here and be among those folks that you've been able to talk to who have seen New Hampshire through their own lenses.
Bedford. I'm from Londonderry myself. So how did you end up in, the world of healthcare?
I think for me, some of the seeds of advocacy were planted through service, through service learning, and through opportunities to do community service as a youth, whether that is through church or whether through volunteering in charitable work with my family. I think that I was somebody who at a young age was comfortable speaking out if I saw something small and unjust. And
Wait, do you have an example? Like, give me an example. Or do you have like did you stand up to a bully on the playground or something? Like,
I can't say that, but
Yeah.
I was, I think, somebody who was inspired in a frustrating way when I saw gender differences early on in my life. And particularly, I came of age at a time that young men in the Catholic Church could be altar boys and young women could not.
Right.
And we didn't even have what they then later had in the church, which was an accommodation for altar girls.
Yeah.
And so I think that was actually one of my first observations in my own life,
Right.
where I felt like the values that I was living and the maybe merit system or
Right.
inclusion of my own life showed me that there may be paths of adversity and maybe
Right.
not everyone is treated equally. And it was just, I think, something I reflect on now because gender and access to inclusion for
Right.
all are threads that have carried on to my career. And
Yeah.
so having taken a pause to share that anecdote,
Yeah.
I think I found my way to law school as a way to raise attention to issues that I cared about. And while my path out of undergrad to law school was a lot about my interest that I had at the time in environmental issues, environmental law, environmental justice,
Yeah.
there were a lot of connections between environmental justice work and healthcare work. In particular, where were a lot of the negative issues of toxicity and distributive pollution in lower income communities showing up, whether that be lead paint in neighborhoods, even in housing here in New Hampshire, whether that be where people want to site landfills in locations in regard to different populations. And I think it was through that lens that I became interested in doing legal aid work, civil legal services work. And that was the place that I got into the New Hampshire advocacy scene. I started my career out of law school as a legal aid attorney up in Berlin, New Hampshire, which was a super important opportunity and a place to go for somebody who wanted to help meet the needs of the community with regard to folks having very similar to the work really that we care about at New Hampshire Possible today in 2025, which is how do we advocate in our communities for folks to have access to services or benefits that will give them basic health and well-being? How do we have opportunities for fairness in our economy? And how do we have civic systems and institutions that promote democracy and promote our ability to be in communities? And the legal aid work gave me an opportunity to see the needs of communities in the North Country, both individuals and groups. And it was through that work that I would say the challenges that New Hampshire residents face in accessing healthcare, in accessing housing, and in accessing many of the other societal supports that help them thrive in the community came on my radar. And I had the ability to begin to see how to use my voice and my advocacy and to help others be able to tell their story or fight for the individual or community benefits or rights that they might be entitled to, and that somebody who had legal training would be able to support them with.
So what you're doing now, at the
New Hampshire Health Cost Initiative.
Yes, the New Hampshire Health Cost Initiative. What is that? How did it begin? How did you begin working there?
The Health Cost Initiative is a movement that we are trying to build with a network of diverse stakeholders who are concerned about the rising cost of healthcare and all of the access challenges that it presents. The initiative itself is really building on some years' worth of work that stems from some research and policy analysis that's been housed at the Institute for Health Law and Practice at the University of New Hampshire and at the Health Policy Institute at the University of New Hampshire Law School and the Endowment for Health. Some leaders in the state who have been gathering and really trying to ask the question about what is driving our healthcare costs in New Hampshire, what is similar in New Hampshire to other states, and what's different, and what might be our opportunities to start having conversations that are broad and inclusive and get people to think differently and think more broadly about such a complex and difficult challenge that we are finding ourselves with. And, healthcare is a complex problem that has continued to escalate in the cost and in inaccessibility and consuming an increasing amount of our economic activity, increasing amount of family budgets, and really something that many people feel is like a runaway train without having a lot of levers in order to stop and pause and put some reform in place. And the initiative was founded to build on the good work that is happening in different pockets in New Hampshire, raising questions around this, thinking about innovative ideas, but hoping to think across sector and hoping to work as an accelerant to keep some of these ideas moving forward and to find broader alignment where folks in different silos might not be talking to each other right now about this very complex problem.
Yeah, I like the people always use train metaphors because everyone loves trains, but let's accelerate the ideas to cut costs, decelerate the growth of the costs, right? And it's a really cool topic because it's one of these examples where there's kind of like the folk perception of this issue, right? Which is, you talk to any person on the street and they're like, you're like, what do you think of your healthcare? What do you think of the cost of it? Probably no one is going to be like, I love it. Like it's a pretty like structurally embedded issue that, a lot of people are frustrated with. And I like these areas where, there's an intersection between like industry and academia and, come up with like thoughtful answers for why it's really messed up and how we can make it better. And, the general public also understands that it's, really messed up too, right? So it's like, I don't know, there isn't always an alignment between like a popular perception of a problem versus like, the kind of more expert or academically oriented understanding of it. But healthcare is a one where like everyone's got something to say, everyone has a story, but why, like, what the heck is going on? Like, why is healthcare so expensive, Jennifer?
Well, at this point,
and you're going to answer the whole question. You're like, how much time?
We do not have enough time in one podcast.
Yeah.
And you touch on a lot of things. I would say that I think
I just threw a lot.
Granite Staters are experiencing a lot of dynamics that impact even how they can balance the reason and the emotion that we all bring to healthcare because it is so personal.
Right.
And so I think our system, both here and nationally, is really, suffering from some attributes that even make it hard to start looking at some of the cost drivers. And one of them is, a growing mistrust that people have about our healthcare system. And part of it is, as it is increasingly complicated for them to understand, it seems like there's more and more administrative gimmicks, more and more hurdles to jump through, people spending more money to get less value and get less care, and are exhausted by just the process of trying to understand how to navigate the system.
Right.
Coupled with, what we know, especially as we compare ourselves to other healthcare economies, there is enough money in our system to achieve a lot better outcomes than how we're achieving. And much of that mistrust is growing for people as they see more and more for-profit motives, more and more players who they think are in charge of rationing care or controlling costs, not operating with public interest or public good as their focus, but instead operating more and more like a business. And I think most people, and we hear this in the federal conversations as well, most people do believe that there is some efficiency and economy of scale to be had in our healthcare system, just like in many other areas of our economy. But the way to go about that is often not to put more hurdles in place for those that are seeking care, but to really, what the public is seeking is to roll back some of the layers of what's happening with administrative costs, what's happening with the shift of healthcare into the for-profit sector.
Yeah.
And what we see people less and less comfortable with is the idea that more and more money is being taken out of our healthcare system, delivered to shareholders, delivered to a more profit-making system, and leaving less and less of the healthcare dollar distributed to meet the needs of folks who know their experience is more and more delaying care because of the cost that they're concerned about, or struggling to get appointments in a timely way or in a geographically accurate way. And so people's experience is very frustrating and very much looking for more recognition that no one is minding the store, as one of my colleagues likes to say, in looking at our overall healthcare system. We have lots of different players in the providers, in the large institutions like hospitals, in the payers like insurers and government payers. But when it comes to helping individual families and patients navigate what they have, know how to avoid those high costs and those surprise bills, we have very few resources in the system right now that allow the consumer's voice and the consumer's needs to be fully met and help balance out the real power imbalance that people feel exists in the system. And it really leads to the mistrust that helps us from getting at some of the root causes that I know we'll also talk about.
Yeah. There are lots of examples of, industries or things in our lives where I think we freely embrace the concept of the free market, right? I've heard it described that, some parts of our system, we get the worst of both, like potentialities, where it's like we don't always get the benefits of like pure competition that we might get in other parts of, a more kind of free market, but we also don't get the pure accessibility we might get in like a completely, more socialized version of, hey, there's either a publicly offered version of this product or at least one where the government has a stake in, like offering a plan that can compete with us in the market.
I think a big piece in what you're saying presumes a level of transparency in where our healthcare dollars are going, how they're being allocated. And that still really remains a puzzle, both in New Hampshire, and nationally, as our healthcare system is so fragmented that sometimes we are trying to have conversations with policymakers or even stakeholders within the system, and there are big pieces of information that we don't have.
Yeah. I feel like my whole life I've been hearing some version of the United States spends more money per person, but we get like worse outcomes, than you would expect for the amount of money, that we put into it. So it's like, what question could possibly be more topical and interesting than like, where the heck is the money going? I like hearing you confronting these issues head on, because it's like, whoa, we've made all this progress, but I'd like to say, in 100 years that people hopefully will look back and be like, wow, in 2025, so barbaric, they weren't even that this standard of care, for maternity care and, elder care and all these different areas, like that wasn't being met at that time, how backwards they were for not finding a way to make that accessible for people.
And progress isn't linear, right?
No, of course,
the arc bends and bends back.
Right.
And, progress is met with different types of implementation resistance.
Yes.
And sometimes stepping back gives you an opportunity to relook at how to do it and go forward in a different way.
Yeah.
And that's not to say we welcome or invite some of the challenges that are coming.
Right.
I think the budget cuts that are being floated for Medicaid and for programs that affect the most vulnerable in healthcare can sometimes make it feel very small to have a conversation about what kind of efforts we can make in New Hampshire to bend the cost curve at a time when such a large piece of our federal budget may be reduced or abandoned, or larger issues that are out of our control may cast shadows on the work we're doing.
Yeah.
But it's also a time where it's important if you have a couple of key areas that you feel positive, you can align around. And at the Health Cost Initiative, we have gotten a lot of support for talking about the need for more investment in primary care. And when I say primary care, I mean frontline care. So that's also mental health care and maternity health care. These are the types of cares that individual and families need the most in our communities. And we have both workforce shortages in a lot of these areas here in New Hampshire that are making it harder for families to find providers and get timely care. And we also have challenges with regard to where our dollars are being spent.
Right.
In most health plans and most payers, less than 10 cents on the dollar, even as low as 6 cents on the dollar, is being allocated for these primary care costs. And we know that prevention is what really helps us cut the downstream need for investment in chronic illness and to prevent the need for a lot of those longer-term care. And without the ability to get that care in a timely way, the prevention opportunity is lost.
Yeah. We pay attention to the people who navigate through moments of crisis rather than the people who, behind the scenes, may have avoided a crisis entirely, right? Which, like, arguably is a greater, moral victory, depending on how you want to think about it. It's why I'm so excited to be talking to you, because it's not a perspective that we often get, or get to hear about. Just talking about cost, like it's the lever to improve all other levers. And if we can figure out a little bit of progress on it here, right, other people will study it, other people will learn and iterate. And there's always good examples of cross-pollination, in the way that people tackle these things.
That was making me think about how much this issue lends itself, even though people feel it's inaccessible because it's so complex.
Yeah.
We are at a moment that it really lends itself to people rolling up their sleeves and having conversations more at the regional level, community level, about what they want in their healthcare system, or at the employer level, what's reasonable to be able to give my employees with a balance of wages and benefits for what's available in our community. And I think more and more, and this really has to do also with how the healthcare system is changing, we are losing the local kind of governance that we once had in the majority of our healthcare institutions. And I haven't had a chance to speak yet about how much healthcare consolidation and hospital consolidation is happening in our state. But that is really one of the significant forces that's not only driving healthcare costs, but it's driving some of the confusion and the mistrust that people have about what's left and who's in control.
There is this notion of skin in the game, right? Which is a phrase I like to employ a lot, because it's just like a humanizing, like, how accountable are you for the decisions you make to the people that they impact, and it's a very New Hampshire concept, like we have this tradition of direct democracy. We have an absurd number of representatives in the lower chamber of our legislature, for better or for worse. Like, there's a bajillion of them, and there's an accessibility to our leadership and to the people who make a lot of decisions for us. That's kind of like baked in to a lot of our government, but also to our traditions and our culture. And I think that's a good thing. I mean, this is a shameless, proud New Hampshire oriented show. So, like, how do we get more of that into healthcare, Jennifer?
Well, to the point you're making about advocating in New Hampshire, I have across my career, had to advocate for a variety of programs and investments that I think are very worthy and necessary for the folks that they'll benefit, but not always speaking to audiences that can hear the moral imperative or the rationale in the same way. And so I think, we're always trained as advocates in New Hampshire to talk about how whatever we think the state should be doing will benefit the economy. But in this case, it could not be more of a sincere and pillar argument from within what is happening to the slice of our economy that is going to healthcare, and that is impacting family budgets and the choices that we know people are having to make with regard to delaying and foregoing care or filling prescriptions. And it's also really affecting employers' budgets, how much money they have available to recruit and hire and retain. And I think as the issue of skyrocketing health costs kind of creeps into more and more of our sectors.
Yeah.
The issue that we were talking about with regard to maternity care, we're also hearing is really significant around economic development and business recruitment.
Right.
If you want to start a company in the North Country, or if you want to relocate into one of these communities that is no longer offering a full-service community hospital, it's not an incentive for young families or for young workers who want to start a family to imagine moving to a community that will not allow them to get that care. And I know a shared colleague of ours was on your show earlier, Emmett Soldati.
Oh, yeah.
And he wrote a piece because he was born in Rochester at Frisbee Hospital. And as of 2022, there are no more babies born at Frisbee. And his op-ed that he wrote that I really appreciated was about what it means for a community when you can no longer be born there.
Yeah.
And it has
Not
this
good.
kind of, it has a ripple effect
Right.
of the kind of demographic doom of not being structured to welcome what young families need. And I think that is not only a New Hampshire Health Cost Initiative, it's a New Hampshire Possible issue.
Yes.
Because there could not be a more important time for us to be thinking as communities and as leaders. What are the supports that we provide? What is the civic infrastructure, the healthcare and the economic infrastructure, so a young family can start off in a way that they're well positioned? And if they're getting their care far away from home, if it's only an ambulance and a set of difficult circumstances that caused that birth to be safe because of rural conditions and lack of health care, then we are incurring costs in a different way in our system. And whether that's actual economic costs of delivering that care in a more acute situation, or it's the cost of not having the resources in more of our communities because of how perhaps misallocated the resources are with regard to many of those baseline services.
Yeah. No, I mean, it's I love talking about the economy as it relates to all these things, right? Because we're used to talking about it as though it's this amorphous thing. I liked framing it in terms of real human people, and you want to talk about like, how does this impact the economy, right? Of like, okay, sure, I can see the argument, however many sides of it there are, of like, you might save some money closing a service, at one hospital or something, right? No new babies in this town. Yikes. But like, okay, 20 years from now, I would suspect that in terms of the economy in the long term, that would be a deleterious impact. You're losing all the other ancillary benefits that people get of like, let's make Rochester a really pro-family place, and it's just, how do we channel more of the urge to like serve other people, solve problems towards ends that are productive for everyone, right? We have talked about all these different things that are, messed up, but like, how does some of this get better? What's different about doing it this way? What does working with and at, the New Hampshire Healthcare Cost Initiative allow you to do that, maybe you couldn't do before or somewhere else?
Well, first I'll answer it, I think, on an individual level,
Sure.
At which maybe I'll digress, but maybe you'll find it interesting, which is, I think doing this work now is kind of a reflection of a very traveling upstream path of my career, which is, happens to a lot of people. In fact, nowadays, if you're on LinkedIn, you'll occasionally see people that use a word now. It's called an upstreamist. And so
I haven't heard that.
If
like
I can
that.
be that, maybe I would like to be that, because I
better
think
than salmon.
my own my own insight into healthcare, started back at the intake desk at New Hampshire Legal Assistance, and I had a case pretty early on in my young career where a family came in and they were uninsured. This was before the Affordable Care Act, and even before children's health insurance plans.
Yeah.
And their son had experienced a terrible snowmobile accident and spent some days in the hospital, and they were faced with a $14,000 bill. And when they came to New Hampshire Legal Assistance, it's really a bill collection issue.
Right.
We help them understand the charity care they can apply for, help them get on a payment plan, and quite honestly, help them understand personal bankruptcy, because all too often, and that's more true in 2025 than it was probably back a little before 2000 when I was working with this family. But a few months later, they came back, and the medical bill had turned into a lawsuit where the hospital was seeking a lien on their home.
Oh my God.
In order to collect the $14,000. And now I will say this was a nonprofit hospital. They were all good people doing the job that they're supposed to do, whether they're in the medical bill collection department or whether they're at the board of the hospital. This family was uninsured. They owed a lot of money. And despite that they were a nonprofit, they were potentially going to lose their housing in order to pay for their health care. And I could take that case at New Hampshire Legal Assistance because I could protect their housing. And I did take that case. And, you know, that case allowed me to peel back a lot of layers about what was and wasn't happening with regard to consumers understanding when they are and aren't entitled to charity care from hospitals. And it was also a way to recognize that sometimes the cost that families experience for one of these very essential issues will show up in a deprivation or a reciprocal cost pressure somewhere else in their life. So if I can erase their medical bill, but I can't protect their housing, then what was the value of that interaction for my advocacy? And I think in looking at where we might be in 2025 at the New Hampshire Health Cost Initiative, you know, there are sprints and there are marathons in the advocacy space based on different kinds of challenges and opportunities that are before us. Some with immediate deadlines that we understand. A legislative session ends, an election day is before us. And some with only time horizons that we set because we don't want to move forward until we have the right consensus or the right amount of alignment to go forward together with whoever the new coalition of Together is. And I think the work that the Endowment for Health and some of the partners at the Health Cost Initiative have entrusted me to help coordinate, and that work is really about lifting up a lot of work that other organizations, some of I've mentioned, some of who I hope to mention are doing, is to just think a little bit more about the marathon of health costs and the information that we need at the get-go, the data and the transparency and the consensus and alignment around what are core values we want in our healthcare system, what are core services and attributes, without necessarily just living in the silo of which payer we're dealing with or which stakeholder we're dealing with. And it's slow and steady work. I would say, you know, it's not a new organization. It's simply just some additional network and resources to put more gas in the tank for some things that are underway or some people who are anxious to and interested to be connected with other people with similar ideas. And so, you know, whether it's in the business community or in the patient engagement community, we have started to see a real receptivity to both the listening part of this conversation, which again, I think the marathon approach lends itself to. We've got some real developed ideas at the Health Cost Initiative based on focus groups we've done, based on leaders we've talked to. But if we can't build a bigger tent for advancing those ideas, they're not the right ideas. So we're taking them out into different sectors and doing surveying and kind of questioning how people are experiencing the health cost crisis and how they might be thinking about the kinds of solutions that we think could get some traction. And that is a way that, you know, we hope the marathon approach, maybe not in one session or not in, you know, one electoral term, will allow us to develop more of a shared vision. And for the Health Cost Initiative, you know, that shared vision will allow us to move forward to lower costs and improve access. But when kind of in arm with our New Hampshire Possible partners, it's about much more than just healthcare. It's about the broader economic and health and well-being that our residents and families need to make for healthy communities in New Hampshire that we all can contribute to and that we can all feel safe and healthy in.
I love how you frame it as, I mean, the marathon, like everyone is talking all the time about, you know, what's possible and, you know, this legislative session or, you know, with this coalition, right? And And I get why, right? Like obviously, the government and what lawmakers do is of incredible consequence to, everyone in a variety of different sectors. But it's refreshing, to hear people, kind of think beyond those terms of like, yes, of course we need to work with, the government and, the lawmakers to, accommodate solutions and pivots and adjustments to the law where it makes sense. And it's probably not a thing that I think a lot of, even political operators are used to, right? This idea that like someone could approach them and be like, we want your input here. We want you to be involved. And, we're still going to be here, at the end of this term or that term, or if you lose your seat or not, right? Like, I love the upstreamer thing, that you shared. I haven't heard that, but I'm going to take that and I'm going to be using it now. It's an approach we need more. All right.
I think about that particular client and that particular interaction, and now being at a place where setting policy for how hospital resources are allocated to protect consumers so they have the right experience on the front end and aren't spending energy with medical bill collection or defending their housing in order to get their health care. Hopefully, in that way of looking at the issue on a larger horizon with a larger group of stakeholders is appropriate for the time.
Yeah. Well, it's not funny at all, but it is the fact that it's a snowmobiling accident makes it like a very New Hampshire oriented story of like, how do we tell this very personal, important story, but like to New Hampshire people, right? Of like, snowmobile. I swear to God,
Well, you know what? I think I just want to say though, I think that's a little bit, I felt like at the time in a small community, quite honestly, like, if you had a snowmobile, should you sell it to pay your medical bill? I think one thing that happens too often in our communities is that because we have a little bit of a scarcity mindset, or we have a little bit of a sense if that person's health care is forgiven, then does that mean that my health care costs more? And part of what I hope we're able to do at the New Hampshire Health Cost Initiative, but it's a big shift, is think a little bit more abundantly. And, shout out for the abundance.
Oh, you're speaking my language.
And what could go right, Andy?
Yes.
Possibly go right. And to just think a little bit about not trying to have conversations that pit people who have and don't have any particular kind of essential benefit like healthcare against one another. And I think a lot of how resources are allocated or people who benefit from the existing models often reinforce that. And the groups I'm working with are really trying to take the pause to really try to reflect back how too often we're having conversations that don't recognize that we do have enough resources in the healthcare system, and we do have enough resources in our state to deliver a different kind of health and well-being for our people.
So we've been talking about a lot of different things, Jennifer, and I want to just ask you, the blunt question, right? Like, and you've answered it in different ways, but just to frame it simply for the people watching or listening, like, why the heck is healthcare so expensive why is it?
Well, there's certainly no one driver behind the escalating costs that we have been experiencing for decades now. There are some, however, key significant issues that we and others who understand the levers of health policy are focused on. And so certainly there are issues of workforce shortage and labor market. And whether that's doctors and nurses or whether that's others in the healthcare system that can make sure folks get cost-effective, timely care. There are hospital and other healthcare consolidations and transactions that are happening at a fast pace in New Hampshire. We've seen several in the last few years, and they really change how our healthcare markets organize. They change who is owning not just the hospital itself, but the other kinds of ancillary practices like primary care practices. And when there are fewer players in the system, they can charge more. And they do.
They just changed the name of the hospital where I live in Conway. Literally, I moved there 2 years ago, and I remember there was a big sign that had one name on it. Now it's different. I think it was like Frisbee something, and now it's like Maine Health something. So like it's I see it in my own life.
That contributes to confusion.
Yeah.
And that contributes to cost.
Yeah.
And then, as you mentioned earlier, we have a race for innovation and technology, whether that's in medical devices or whether that's in other kinds of innovation that while we are excited in so many areas of healthcare to bring new disease cures and prevention mechanisms, that kind of research and that kind of new innovation brings new expenditures to our system. And in one area, we know that's incredibly robust and under-regulated is in pharmacy costs.
Sure.
And then New Hampshire is a state that's aging. And so while, I mean, all states are aging, the costs of a older population bring unique healthcare costs. And, it's really at the intersection of a lot of those expenditures and the reality that we have very little oversight in the state of New Hampshire that allows us to put the pressure on some of these organizations to act in a way that's not simply market oriented and not geared towards the dollar, but balanced with the community.
Yeah.
And it's with that in mind that some of the solutions that we are working on at the Health Cost Initiative are geared towards looking at that broad range of health cost drivers.
So of those examples, maybe dig into one or a couple in particular. Like we got these different problems, labor and, labor supply, employee issues, not enough doctors, not enough nurses, maybe not enough training in the ways that we need, consolidation of healthcare providers, innovation of technology, great but expensive, right? Demographic changes, as we're very older. The whole country is aging, but, we're kind of an outlier, particularly in New Hampshire, right? Where of those, like when you look at these, where's the opportunity for I don't know if progress is the right word, but, convening to talk, to begin like how do we make it better,
Well, across those drivers, we have identified and gotten some shared feedback about some what I'll kind of consider cross-cutting solutions. So they address or touch upon more than one driver at a time.
Yeah.
So the first would be more tools of oversight. What are ways that whether or not it's within the existing industries or with trusted third parties, we can make sure that there are voices designing the system and allocating resources that are helping us understand the problem. As I mentioned earlier in our conversation, we still lack the kind of transparency and insight into understanding our system. And so the Health Cost Initiative really wants to be advocating for the types of central depositories of information so we can begin to understand how resources are allocated and what services are being understood. And that's really a unifying solution, because if we can see more about what's driving the utilization, we can apply more rational and reasoned fixes.
Right.
Another area that cuts across what folks are experiencing across all those cost drivers is investing in more resources for patient advocacy or consumer protection.
Sure.
In many states, although not New Hampshire, there's an agency or a mechanism set up so that both individual consumers and then at like an ombudsman level, systemically, consumers are represented in their individual needs and in their collective needs. And so a consumer advocate program or an ombuds program in New Hampshire could operate to both coach and train individual consumers, navigate with them as they need. What are the complexities in my network? How do I make sure that I have chosen healthcare provider that I'm not going to incur a surprise facility fee? How can I make sure that my service delivery decision that was denied can be appealed because my doctor really wants me to get this care? That kind of individualized consumer advocacy we don't have for patients in New Hampshire, at least not in a way that they feel collectively heard and seen. And then the benefit of having a program like that is that you can really understand the difference between a trend and an anecdote. If the same person calls with the same, or if different people are calling with the same problem into an intake line with that, then it warrants perhaps a different kind of systemic solution, or bringing it to policymakers or decision makers that were experiencing more of a system failure as opposed to an individual consumer who needs help navigating the system. And we know that having these kinds of advocates and patient navigator programs in place cause the system itself to be more responsive. The industry and the other institutions, when they know that clients are represented and have advocacy to have their rights protected, then there's just also often behavior change in the overall ways that a lot of the consumer-minded decisions are made. And that both gives people more hope in accessing the services that they're paying for, and it gives the system a bit of a balance, not enough of a balance to make up for all of the money and corporate interests that are also driving some of our healthcare right now. But it does help consumers feel greater trust when we have consumer protection and ombudsman, and it helps our system have healthier ways of checking what's working and what's not working.
Yeah. Oh, I like that very much. You know, it's like, it's an ecosystem, and if there's, you know, too much kind of unchecked, you know, influence in one area, it's like, well, what do you expect? They're gonna do what's in their interest, right? So like, how do we design or tweak the system so that, you know, there's a bit more of a, you know, rapport or healthier relationship between, you know, these oppositional forces, you might say, right? It's kind of like, you remember that scene in the Incredibles movie, you know, that Pixar movie, right? Where
I know the movie, but I'm maybe not going to follow.
No, you'll remember. He's like the superhero, and he's like got his like soul sucking job. He works for some insurance company, and you know, this poor old woman calls, and you know, I mean, this is like a total. Someone's going to listen to this and be like, "Yes, I love this scene," but you know, she's like crying, and he's like, "I'm sorry, this is a policy. I can't help you." And then he looks around, and he's like, "Okay, go to like page 72." Go call this person, this office, and like that's the loophole, and like you'll get the help you need. And then he gets in trouble for it, and he's, you know, he almost gets fired, or he does. And you know, that's like a comic example of like, you know, almost like a stereotypically kind of, you know, ridiculous of like this corporate evil person, and you know, Bob Parr, the hero, is trying to help the person. But I think there's something true about this idea that, like, as you said, the system often can prevent, you know, regular people from helping other regular people, right? And it's like, you look around like, what the heck is going on? Like, what? Like, I don't want this, you don't want this, like, can we make it better?
Well, but what also is happening, and I'll say, you know, and I find this amongst professionals, is, you know, people who are perhaps, you know, trained attorneys and well aware of those loopholes and know how to navigate the system, are equally frustrated and finding themselves on hold for multiple hours and unable to get what they think they've paid for in the system.
Right.
And so it is transcending people's literacy level with how to use the healthcare system, or even their willingness to stay and fight for what they've paid for. The breakdown seems to be across levels, whether that's, you know, people who know and understand the system, as understandable as it is, or people who are not even opting in to utilize the system because of the complexity or the fear of additional costs.
I love this concept of like an ombudsman, or, you know, kind of a consumer advocate, right? Like, you go to markets in different parts of the world, like farmers markets, where there's more of a human interaction, you know, at the point of sale between, you know, the buyer and the seller. And this idea of a human dynamic between, you know, people in commerce is like very old and very natural, I would argue, and I think very American. The idea that there's anything you can do about it is an idea that I think would do a lot of good.
Well, what I pick up on from people is, you know, I think if they feel their time is well spent and it's going to help them direct their own care and have kind of autonomy in their process, then no one likes to spend more time on it, but there's some optimism that they're not going to be spending the time they've been wasting on it, you know, spending it better. And so it might be that, you know, I think that the system is so complex that there must be an unfairness reason why you pay $50 for a copay to get the same service that I pay $100 for.
Yeah.
But if I had time, or my employer had time to explain that there's a larger rationale for that, that I have a shared decision in or I have a shared benefit in, it helps eliminate or kind of dissipate the idea that it's a system within where people are rigged or pitted against each other with different treatment or different levels of benefit. And in some ways, all of the complexity we have in our system adds to people feeling like, well, maybe I'm just not being treated fair.
Right.
And I don't know what fair is for me.
Right.
And the amount of research that I would have to do and the amount of interchange with my employer and others is just not worth it. So I won't even open the inquiry.
Yeah. This idea that people don't just have to sit there and like take it is not a thing people are used to hearing, you know, particularly in healthcare. So there's a lot to like about what you're doing.
Well, thank you.
Yeah.
And there's a lot to find out there in the communities of New Hampshire where people are either having these ideas or looking across the state and wondering if they can be connected with another dot who is thinking the same thing or ready to take action in their own community in a similar way. And I hope with the COST initiative, we're going to be finding some of those folks and lifting up the work they're doing, as well as connecting them with others to build alignment around a bigger vision for some of these solutions.
Yeah. What do you think is an opportunity here in New Hampshire? Like, in what way can we tackle this in a way that maybe other states can't, if that makes sense? And maybe this is a good opportunity to talk about New Hampshire Possible.
Well, you know, we always say we like to do things the New Hampshire way, and I don't want to oversell that. But in healthcare, there are some solutions that are possible if you have, you know, very large employers and very large groups of employees, and that's not us. That's not New Hampshire. New Hampshire is a state where our healthcare sector and our economy is driven by a lot by smaller businesses, a lot by entrepreneurs, and therefore it seems to really lend itself to that. We're interconnected in lots of small ways, and not everybody's just wearing one hat out in their community.
Yeah.
And so the Health Costs Initiative also isn't about just what we're doing, but it's about how we strive to do it. And so, as we discussed, you know, more community-centric, more listening-oriented, trying to bring ideas, but marinate and mature ideas at the community level, and have people who are used to thinking about this, maybe just wearing their business owner hat, begin to think about it also as, you know, a community investor in a larger healthcare system, to be able to break down the barriers between employers and employee when they talk about value and remuneration and what healthcare means.
Yeah.
And so I think that we have the way we have to get things done, and that our initiative hopes to really build from the grassroots of the strength of our community up, so that some of our solutions that we're talking about, whether that be in Concord and Washington, are also rooted in the kind of alignment and hopefully appetite for change that we can be building across New Hampshire communities and across different sectors who are stakeholders in the health cost challenge. About the time that I was learning about New Hampshire Possible, we were bringing forward some of the New Hampshire Cost Initiative work in more of a launch capacity. And the capacity to be connected with organizations that share a vision across community engagement and across some issues that really connect with an overall sense of our people and families doing well, or our communities doing well. And while health is a key part of that, so too are, you know, access to economic opportunity, access to childcare, other parts of the health system, and the opportunity as a small initiative to be connected with other organizations of similar and kind of intersecting or overlapping goals and ideas from a kind of professional solidarity perspective was motivating, and as a project that often works with just one person or a couple of consultants, you know, working as part of a field, and also being organizations that are in one way or another connected to the Endowment for Health's larger vision or larger leadership in the state. And then I also think, as you and I have discussed, you know, there are a lot of ways that people are feeling overwhelmed and out of control with, you know, forces that are infecting them in policy, affecting them in the economy, with so many cost pressures affecting families. and the ability to put time and energy into putting a positive frame on what's possible here in New Hampshire, and also looking at the intentionality that comes with bringing problem-solving techniques and tools that acknowledge that some of the issues that we work on are divisive, and even acknowledge that across the advocacy spectrum, there are lots of different tactics that are necessary and that we support and applied. But within our community of learning and with our moving forward across some of these issues together, hopefully we're both building resilience in the way that some of our work is also pushing back against erosion or attacks on values or programs that we care about. And hopefully, bringing newer ideas or positivity in a way to think about how our work intersects more broadly with other work.
And optimism, right?
Optimism.
What does that word mean to you?
It means believing that we have the wherewithal amongst challenges to harness resources and kind of organize our way into building solutions to match problems.
All right. Well, Jennifer Frizzell, I've really enjoyed talking to you. Thank you very much for coming on Granted Goodness, and keep up the great work.
Thanks for the chance to be here.
Hey there, thanks for spending some time with us, and I hope you enjoyed the conversation. You can learn more about today's guest and how to get involved with or support their work in the show notes. If you'd like to suggest a guest for the show or have any story tips for our Good News in New Hampshire newsletter, shoot me a message at hello@granitedgoodness.com. Music for this episode was provided by the band Sneaky Miles, who hail from Newmarket, New Hampshire. Until next time, I'm the creator and host of Granted Goodness, Andy DeMeo. Thanks for listening.